Good morning, everyone. I'm Denise. I'm the clinical nurse specialist associated with this project. This was a demonstration project, a 3-year project funded by the Ministry of Health, looking at improving live kidney donation amongst specifically counties' population, but with the intention of producing some results that were applicable across the country. So why? And as we all know, we have a very high proportion of end-stage kidney disease in counties. As Sarah just said, we have 600 people on dialysis, and so we know about the persistent inequalities and inequities for our Māori and Pacific. So the project focused mainly on those priority populations, but also was across our entire dialysis population. So this is the county's Manukau population on the left. Is there a light on this? No? Is there a... Oh, doesn't matter. So on the right, our Pacifica and Maori population highly overrepresented in our dialysis or in our general renal service population. In terms of kidney transplant activity, this is both live and deceased donor activity between 2007 and 2011. As you can see, Middlemore has performed very poorly in terms of getting our patients transplanted. The reason that we look to get our patients transplanted is it's the best renal replacement therapy available for all of our renal patients on dialysis or pre-dialysis. In terms of ethnicity, we were doing even more poorly. If you recall, we have the highest proportion of Māori and Pacific on dialysis. However, very, very few are being transplanted over that period of time. So this information plus a look at Māori Pacific attitudes to transplantation in 2009 provided us with some background around attitudes to transplantation, and while there were cultural issues for Māori and Pacific, they found very strongly that there was a lack of focus and clarity in the healthcare team, and also in terms of the consumer poor health literacy and a lack of knowledge in terms of access to transplantation. So we had 8 interventions within the project, basically to improve the infrastructure around clinical and support services, increase donor offers to over 30 per year, and increase live kidney donor transplants to around 20 per year. So the interventions are as follows. We developed multimedia recipient and donor resources, home-based education, peer support program, a home and kidney first policy, preemptive transplant education, so that is getting to people before they start dialysis, engaging with primary health to upskill them in terms of their knowledge around live kidney donation, community-based education. And this project we partnered with Auckland District Kidney Society, who is the community support group for people with kidney disease. And finally, looking at people, what were the influences in the community, who influenced people around making decisions around live kidney donation. Was social media effective in improving live kidney donation? So we looked at that aspect of the intervention. Now, unfortunately, due to the limitations of time, I'm only able to focus on the most successful of the interventions, but happy to answer questions about the other interventions in question time. So in terms of preemptive transplant education, so this is trying to achieve transplant before dialysis, which provides the best outcomes for people. We worked with our pre-dialysis team to improve resources and to improve the conversations that they had with patients around transplant. So previously transplant had been the kind of thing they talked about after they discussed with people about what type of dialysis, and that conversation has now changed, and transplant is discussed as a primary modality with dialysis to be considered as well. So it's trying to ensure that transplant is discussed at all stages of a patient's journey through the renal service. Home-based education, so this was a unique approach to trying to improve live kidney donation. We had a cultural educator, so we had a Māori and a Pacific cultural educator, and myself, who went into people's homes with the recipient's consent or the patient's consent to talk about their journey, their experiences on dialysis, what it means for them, and to educate the family, whānau, extended family, friends, anybody who wanted to come, and to talk to them about what was involved in live kidney donation, to try to ensure that there was a consistent message going out to family, and to try to achieve more donor offers. So from 40 meetings, we had 23 people offer to donate, and we can attribute 4 live kidney donor transplants to those meetings in the project period of 3 years. The multimedia resources, there were very, very poor resources for live kidney donation. So with the assistance of a health literacy group, which was Workbase, which is now Health Literacy New Zealand, we developed 3 books, book 1, book 2 for live kidney donors, and a recipient book. They are to be translated for Pacifica, and there is also going to be Māori themed books. And we also have a website which is the top Google search. If you Google live kidney donation in New Zealand, that's the top Google search that will come up. These books and resources are available also on the website. And we also have had a free call number, so we know that our population has poor internet access. We know our population uses cell phones but run out of credit, and so we provided an 0800 number for people to call for live donation offers. So we also receive inquiries through the website as well. So there was just trying to develop different methods for people to make contact with somebody who was going to help them through the process. The home and kidney first policy, so in counties we've always had a strong focus on home dialysis. Around 50% of patients are on home dialysis. So in association with that, we worked on kidney first as well, which integrated with that initial slide around improving our preemptive transplant. But what was really important about this was to get a whole of service approach to improving live kidney donation, and overall we improved the referrals for dialysis. So our results, so these were the offers, as we wanted more than 30 per year. We achieved up to 80 in 2015. The green line is people the red line is people who offered, the green line is people who continued with evaluation. These are our live kidney transplant results. So we were averaging around 2 a year up until 2013, and we've averaged 10 a year since the project began. Most significantly, we have 6 Māori and 12 Pacific Island in that time. Previously, there had only been 5 Māori and Pacific in the previous 8 years. So a significant increase for Māori and Pacifica. We've also evaluated donors from outside the area and increased our preemptive live kidney transplants from 3 and 10 years to 8 and 4 years. Unfortunately, didn't achieve the 20 per year. That was quite aspirational, but we're very happy that we have improved the lives of those recipients and their families in that time. So just finally, just remind you of the slide where we did very poorly, but last year Counties Manukau was the top performing DHB for live kidney donor transplants. I'm presented this on behalf of the project team, and that's them.